Hello, I'm Jeremy Fernandez. The crippling effects of the coronavirus are now in full force, with Australians' home and work lives upended by the continuing crisis. There's still a stark reality the nation faces: more serious illness and death, and a health system at breaking point. That's been rammed home this week by the significant jump in the number of cases. Here's how it looks. From almost 900 cases on the 20th of March, we now have more than 3,000. That's more than triple what it was a week ago. Here's what that means. Other countries that have moved on the same trajectory as Australia have reached the limits of their health systems and hospitals. There are measures here to flatten that curve, but we won't see the results of that for a little while yet. Governments around the world are now enforcing strict controls to halt the spread. New South Wales is the state with the largest number of cases. It's now prosecuting those who don't follow physical distancing requirements. In Western Australia, one of the 255 infections is a 5-month-old baby whose parents both tested positive and are at home in self-isolation. 2 10-year-olds have also been infected in South Australia, and in Tasmania there's a ban on gatherings of more than 10 people in public or on private properties as well. Those figures have prompted the government to call in the Defence Force to ensure international travellers are quarantining themselves from the rest of the community. Concerns have been raised about people returning from overseas and not self-isolating, particularly after getting off cruise ships. 2/3 of the positive tests in Australia are from those who've recently returned from overseas. Defence personnel are now being enlisted to help state and territory police monitor those who are compelled to stay indoors. The Prime Minister, Scott Morrison, says Australians must get used to the new normal.
Frankly, if we were to go to further restrictions and say that they might be done for 2 or 4 weeks and reviewed after that time, you better be ready to do it for 6 months. And because at what point do you pull it back? And I think with what we're learning about the virus, that will present very challenging. Now, let's hope that that wouldn't be required. But the reality is, I think, if we're being really brutally honest, is that once these restrictions come in place, they stay in place and they'll be in place for some time. And we'll all have to keep adapting. And as I said, this week, the way people adapted gives me great encouragement.
Now, anyone hoping for a third tranche of economic stimulus to ease pressure on renters and mortgage holders have been left in suspense. Many had called for it after long lines of sacked and stood down workers formed at Centrelink offices around the country. There are widespread reports of landlords not providing rental relief, partly because they're not getting any relief from the banks on mortgage repayments. Meanwhile, school closures are dominating the agendas of many families as more of the country is shut down. Queensland, South Australia and Western Australia have all announced the suspension of normal classes. Classrooms will only stay open for the children of essential workers. The move followed an anxious debate between stakeholders and parents, and the federal government stuck to advice that schools remain safe for children.
At the moment, teachers are stretching themselves very thin, are highly anxious about their own safety, being adults in a school, and they are begging for some clarity from the government.
It's about recognising our staff need time to develop and prepare and do the professional development for what in term 2 is going to be a very different way of delivering.
The outcome is a great outcome. What we're seeing here is decisive action around making sure that we've got clarity for parents about how they can manage the students that they have, the children that they have, and how they might be interacting with learning over the next little while. For us, it's about certainty, and it's about giving us a clear position to make sure that our young people have got something to go to, but that our principals and teachers are able to prepare for the future.
Well, fines are now being handed out to people who don't abide by the government's strict physical distancing rules. But if you're still in any doubt about why it matters, have a look at this. On aggregate, one infected person gives the virus to another 3 people. Then those 3 people each give it to 2 or 3 more. Now 9 people have it, and they pass it on, and so on. But if just one of those original 3 stays indoors, the risk is removed for nearly 1/3 of those people. If another person, for example, doesn't go out to dinner, they don't pass it on either. Now, if you can work from home rather than mingling in the office, the spread of the virus is also slowed down quite dramatically. Research from the University of Sydney suggests that for this to work, 8 out of 10 people need to practice physical distancing. If that slips 7 out of 10, the virus spreads at a much faster rate. This chart shows just how that works. If 8 out of 10 people comply with the distancing rules, the curve will go down dramatically over the course of 13 weeks. If 9 out of 10 do it, the curve falls even faster. But if one person leaves their home when they don't have to, everything we are all doing is for naught. So, with the increasing caseload in Australia, are our hospitals ready for the influx of patients? The main concern here revolves around intensive care beds. Australia has around 2,200 of these. More than half of them are in New South Wales. It's not clear how many people will get COVID-19, but some authorities are bracing for at least 20% of the population to become infected. If that happens, it equates to 4 to 5 million Australians. Overseas, around 5% of patients have needed ICU treatment. If that happens here, that's around 250,000 people in need of an ICU bed. COVID-19 patients generally stay in these beds for around 10 days, and that treatment can be the difference between surviving and dying from the disease. And you can see on this chart how those estimates compare to what Australia usually sees in intensive care each year. Even the lower estimate of 20% of people becoming infected far exceeds the average annual admissions to ICU. On this scale, admissions from the flu from past years barely appear at all. Hospitals are scrambling to boost capacity, ordering extra ventilators. But it's not just about equipment. Just to double Australia's 2,200 beds will require another 10,000 ICU nurses. So it's a scramble for people as much as it is about medical supplies and equipment.
First a city, then a country, then the world. With reports of deaths on most continents and no vaccine in sight, the questions remain. How far will the virus spread? How many lives will it take?
Well, global attention has now turned to the US after it overtook China with the largest number of cases. It now has more than 85,000 infections, although they've recorded fewer deaths than China and Italy. Those two countries each has around 80,000 cases. Across the world, there have been more than 500,000 positive tests, but crucially, more than 124,000 people have already recovered. All up, there have been 24,000 deaths around the world. In Australia, 13 elderly people have died. The changes to our daily lives have been profound, with many people wondering what they can and can't do while they're at home. I put some of your questions to the infectious diseases expert, Dr. Sanjaya Senanayake, and our national medical reporter, Sophie Scott, earlier. I want to get to some questions to do with isolation. This has been the big theme of the week. There's been a bit of confusion around as well about what isolation means, what quarantining means, and what social distancing, or physical distancing as we like to call it now, means for people, depending on their circumstances too. So Sophie, I'll come to you with this one. This is a question we received off our website. How many people are allowed in a car? How many people can I invite over to my house?
Well, I think the authorities have been pretty clear about inviting people over, and the goal is really just to maintain the people who live in your house as the people you have contact with. So we really shouldn't be inviting anyone over other than the people who live there at the moment. I guess in terms of going out in the car, it should be the minimum number of people for the shortest possible distance. And again, only for those necessities like getting to work or going to the groceries to get groceries or going to a medical appointment. I think they were pretty specific because I think people weren't getting the message. They were thinking, oh, I can't go out to a pub or a restaurant, but I'll have people over. And I think they were very clear in that messaging, and that having barbecues and having extended family gatherings, all the things that Australians love to do, we just can't do at the moment. And that's why you're seeing a lot more people doing virtual catch-ups as well, having, setting up a group chat on one of the streaming programs where you can all get together at a certain time and catch up that way, because the feelings of isolation that people have is very real. And so they're looking at sort of new and innovative ways that you can get that sense of connection that you would otherwise get in person.
Dr. Senanayake, can I ask you this question from Heath Banyai off our Facebook channel? Do you need to keep a 1.5 metre distance from your spouse and kids, someone whom you live with?
Right. So in terms of isolation and social distancing we're talking about, I think if you yourself haven't been told to isolate yourself because of an exposure to someone with COVID-19, and we're just practicing social distancing as a society, in one's house, I would just mix with one's family as one normally would. I think that is quite reasonable. Of course, if someone becomes unwell, whether it's COVID-19 or something else, then have an increased sense of practicing social distancing. But I think within the same household, it's probably reasonable to mix and very hard to do otherwise, I would have thought.
Sophie, there is this question from our website. Is it safe to get cleaners, plumbers, builders, gardeners, those sorts of workers over to your house to perform tasks?
Yeah, look, that is a question that I don't think has been made perfectly clear. I guess you could look at how crucial is it that you have that person come to your house? Could they take precautions like gloves and masks and things like that? But I think you probably want to look at just how essential is it that they do the work that you're asking them to do. If it's something you could put off, if it's something you could do yourself, like cleaning, you're probably better off to do it yourself. If it's something like plumbing or something electrical you need fixing, it's probably safer not to do it yourself. But I guess it would be wise to just think about how important is it that you have that person come into your house at the moment.
We got a number of questions relating to how transmissible the disease is and whether it's airborne. Someone wrote to our website and asked, I live in an apartment, should I keep my front door and windows closed? The concern there, of course, is that the disease is airborne. To what degree is coronavirus airborne?
So it's transmitted by droplets. So COVID-19 is transmitted by droplet transmission. So if people sneeze or cough, the droplets containing the virus fall within about 1.5 meters of that person. And we can get infected by our hands getting on those droplets and then touching our mouth, nose or eyes. Or if we're directly at a very close distance coughed or sneezed into. Now, you can get it aerosolized or airborne, but that's only in the context of hospitalization and certain procedures. So I would not be worried about opening your windows in terms of getting coronavirus or COVID-19. Particularly if you've got a lot of people in the house, it might be a good idea to air it out.
What about walking past someone on the street?
So again, that should not be a problem. If that person's just breathing normally and you walk past them, not an issue at all.
Okay, so this question then comes from Danielle Golovanoff-Wood of our Facebook channel. Should we be washing fruit and veg in warm, soapy water or disinfecting that fruit and veg when we received delivered groceries because the virus has proven to survive on surfaces? And as we know, in supermarkets, people are they're touching these fruit and veg before you pick them up and put them in your trolley. Dr. Senanayake, what's the view there?
Yeah, I mean, there's the assumption, of course, that there is COVID-19, the SARS-CoV-2 virus on the fruit, and that's a big assumption. But if it is there, giving it a thorough wash should be more than adequate.
If you were worried, there's also the option of like peeling, for vegetables and things like that. And, there are some products that you can get which are designed to take off, pesticides and things that you can wash fruit and vegetables in, and they would probably be a good idea as well. But I guess even as a basic thing, just to rinse the fruit and vegetables first, and then I would probably do that and peel the vegetables just to be on the safe side. But I mean, it goes basically the hand washing thing is just so important that if you're washing your hands and washing, the fruit even just with hot water, that's going to make a difference. And I think the more we can get into the habit of that people sometimes try to complicate the issue and think we need these disinfectants and we need all these other things, but just the hot soapy water for your hands and for surfaces and things like that can actually make a really big difference.
Now, we have been receiving thousands of questions from our viewers along those lines. If you want to hear more answers, you can check out our full 40-minute chat that's available on the ABC News YouTube and Facebook channels. And you can, of course, stay up to date with all the latest information on the special coverage page of the ABC News website. That's at abc.net.au/coronavirus. Thanks for joining us. We'll be back next week. From all of us for now, though, goodbye.